Sounds good. Hello. Okay, guys.
All right, guys. Thank you all for coming. This one I'm particularly excited about. There's been a lot of buzz about this one. It's a hot topic, GLP-1s. So really thrilled to have the team from Nova, Zach and Patrice, true family business. I think we're going to learn a lot, and this is also the first one that we're live streaming. So if anybody out there saw this pop up on Instagram, we're excited to have you guys join us too.
Thank you, Mike. Yeah, thank you guys again for coming out. This means a lot to us and, as a community as a whole. Just want to thank each and every one of you. I know we might have some more people coming in, so don't be bothered by them. But my name is Zach. I'm Zach Schneider. I'm the founder of Nova, the CEO as well. We're a telehealth medical weight loss clinic. This is my mother, Patrice. She works the medical side of everything. She's a nurse practitioner, has been doing it for 30 plus years. So she's well versed in this, category of health. And we as a family just have always been involved in health and fitness and things like that. But again, I just want to thank you guys for coming out and taking the time out of your day to learn a little bit on this, beautiful Saturday morning. But let's get started. So, like I said, my name's Zach. I'm the founder. This is my mother, Patrice. Our goals today, we're going to explain what GLP-1s are and kind of, there's a lot of backlash. There's a lot of things that are being said around the community of GLP-1s as a whole. And, not everything is set in stone with everything that's going on with them. They're FDA approved and now doctors, you probably see them on your TV all the time, in commercials, on Ozempic, Wegovy, things like that. So they're just becoming a big disruptor within their industry as well. People would call them a magic pill, which is what we're going to go through today. They're not necessarily a magical weight loss pill. People think, oh, I'm going to take a shot and call it a day and eat 200 calories and I'm going to lose weight, which is true. But then the real problem is, as you can see at the bottom, when we get off the magic pill, that's when people start to see the issues, because then that weight starts to come back and it just all goes downhill from there. But all right, yeah, we'll move on. So at Nova, who are we? We are, like I said, a telehealth medical weight loss clinic. And what we do is we provide GLP-1s to people who are kind of not using them as a crutch, but using them more of a supplement in terms of catalyzing their weight loss and changing their lifestyle, which is something that, a lot of people we suffer with as a country, is obesity and type 2 diabetes and things like that. And when we began, we're kind of like, hey, there's an issue in our country, there's an issue around our community, and what we're trying to do is be a part of the change that we can, somewhat start. So we take a holistic approach to weight loss. We like to keep your body in mind. We like to keep who you are as a person in mind. We personalize everything around who you are and your lifestyle, and we try to create those healthy lifestyles that you guys, can adapt to. We believe that weight loss is healthcare. Every journey is personal, like I said, personalized results, and results come from consistency, support, and science. So revolutionizing weight loss management with GLP-1s. So as you can see up here, Semaglutide, which is your Ozempic and Wegovy, and Tirzepatide, which is your Mounjaro and Zepbound. You guys have probably heard these names all over the place. And one thing I like to describe them as is when you hear Ozempic and Wegovy and Mounjaro and Zepbound, those are kind of like your Tylenol and Advil versus your ibuprofen and acetaminophen. They're just the brand names to what the actual drug is, the Semaglutide and Tirzepatide, which is why these brand names can market up these prices to, $800 to $1,200 a month and make a great, profit margin off of that. But we'll go ahead. And Mom, you want to take it away?
Thank you, Zach. Thank you again, everybody, for showing up. This is I'm proud to say that, my family has kind of, taken on a very similar role in which I live every single day of my life. I do heart failure, chronic care across the continuum from, birth to death. So, and I see how things progress and how obesity, diabetes, they're two things that we can change. And the catalyst for that is just behavior modification along with some help. So a lot of patients would think that having a GLP-1 would be a cheat drug. It's cheating. It's not. It's helping you. It's helping. So I'm here to explain the other side of it and why it's important and what it does in your body. So a GLP it's a glucagon like protein. And what does that mean to the layperson? Glucagon is something that produces naturally in your body. And how that does is by appetite, by what you eat, it increases the blood sugars, and then the insulin doesn't kick in to bring down those blood sugars. So that's where diabetes sets in, right? And it just sits in your gut and it will just continue to increase. But these GLPs are so it's mimicking the glucagon in your body to now reverse that, to bring down the insulin, bring down the blood sugar and have the insulin kick in so that we can decrease inflammation and make sure that blood sugar is constant. Did you have a question? Sorry, I thought you raised your hand. And it's all about the liver, the pancreas, and now, making sure that everything just stays constant in your body. So you can go next slide.
Yeah.
Again, so it is a protein that will now reduce that appetite, right? It'll tell you that you're fuller earlier, which is what satiety means. It is decreasing the amount of urge. Also, it mimics it in the brain as well to say, you don't need to eat anymore. You're full. It's good. Stop, but you feel satisfied. You can go on to the next. So this is probably what you hear more so on the GLP side of why people are constipated and why does that happen and why do I feel bloated? And it's because you have now food sitting in your stomach, right? But it's going to take a longer time for it to digest. It's now evenly, taking those calories and saying, okay, we can move them through and we're going to use them as energy slower. That's it. Again, insulin, it's not going to spike your blood sugar. It's going to, once that glucagon kicks in, it's going to say, okay, insulin, come on down and break down that sugar so that we can now have a more normal blood sugar. Supporting fat for oxidation. What does that mean? So fat oxidation, it's now creating the fat into energy so that you can use that. So you're going to find that you have a little bit more energy while losing fat, and then you can also use that energy to build muscle.
One thing I do want to say on that actually as well is that should be one of the main reasons why people get on these is because it's allowing you to reshape your body composition at this point. So instead of taking the medicine or the drug and just shrinking your body as a whole, your body, when you're losing weight, your body doesn't know whether to take muscle or fat, so it takes all of it. But when you're strength training, and we'll get to that, and the GLP-1s, like she mentioned, they utilize fat oxidation to its advantage. You should use that to your advantage as well to get rid of your fat and maintain your lean muscle mass as well.
Mm-hmm.
But yeah, sorry to interject.
No, interject anytime. So I'm sure everybody has heard, from physicians, A1C, A1C, A1C. Hemoglobin A1C is a measure of blood sugar. It's a blood test that measures your blood sugar over a period of 3 months. That 3-month period of time, right, you get then a number, a percentage. That percentage will then tell you if you're pre-diabetes versus diabetic. Now, I look at pre-diabetes as kind of like, when people say, I'm a little bit pregnant. No, You're not a little bit pregnant, you're pregnant. So when you have pre-diabetes, you have diabetes. That develops years prior to and months prior to that A1C going up. So this is what we want to do. We want to make sure that we can get our levels normalized and stabilized over a period of time so that we don't even hit that area. But if we are in that pre-diabetes or diabetes, situation with an A1C spike, right? We want to reverse that. And that's what the injectables and the oral pills can do. Now, the injectables, as you can see, is an injectable, it's a liquid, and it's injected either in the abdomen or in the arm. More effective than the pills, only because of the way you have to take the pills. You have to take them without any food or with a little bit of water, and then you got to plan your meal after. So I think it's getting better with now. Pharmaceutical companies are getting better at now making the pills a little bit more effective, but still the injectable is the most effective treatment right now. So, you have an option if you're not somebody who's a little squeamish about, any kind of injections. Research and effectiveness, this is just going to take us through, what these drugs do and how it promotes health. So we have 15 to 20% body weight reduction over about 12 weeks with use of the GLP-1s. That's pretty significant, and you're losing like 2 to 3 pounds a week. Over 12 weeks, you have a duration of clinical studies assessing the GLP-1 effectiveness, and we know that it's been effective, and it's a slow progress. But remember, it took years for that weight to come on. It's going to take a little bit of time for it to come off. Slow is good. Improved insulin sensitivity. Again, that glucagon, once you eat, right, the blood sugar goes up, the insulin's going to kick right in, and it's going to suppress that blood sugar. Cardiovascular markers. That's it. I live this every single day. Like I said, I work in heart failure, cardiology is my specialty, and chronic diseases. I see this every day. People are coming in and their blood sugars are elevated. Oh, but that's fine. I eat fine. Look, I'll show you what I eat. But they don't do anything else to help that. So in addition to the eating healthy, you have to move. So even if it's just starting to walk. So the cardiovascular effects with the GLP-1s, I'm seeing it even as a guideline for our heart failure patients. So a lot of these drugs have been, first of all, marketed for diabetes, and then when they saw that these people were being less hospitalized or having reverse effects for their blood pressure, their cholesterol, their A1C, all of those markers, I mean, I might be out of business soon. Who knows? Reduced inflammation. You cut yourself. Creates inflammation, and then repair of the tissues start to happen. Blood sugar spikes, inflammation, things start to go crazy. And then you have your GLP-1, like I said, will lower the blood sugar. So it's reducing all of that in your body to regulate and keep things at a more normal, homeostatic is what we say in the medical field, homeostatic or normal range. Common dosages. So you have your semaglutide, which is low dose, 0.25 once weekly injection. And then again, we up titrate as you tolerate. So we go low and slow. Thank you. Low and slow with all of these drugs. Right, so we go that, we have the semaglutide, and then we have the Tirzepatide, 2.5 milligrams weekly. Again, gradual increase, low and slow. The difference between the two is pricing, one, and then secondly is toleration. There's not one drug for everybody. You are different than he. He is different than me. Our makeup is completely different. Our DNA is completely different. So what will, if Tylenol works for me, Motrin may work for you. Everybody's built differently. So that's why we go low and slow, see how you do, and we go forward. And then we have the oral semaglutide dosing, which again, low and slow. You have to take it on an empty stomach with a little bit of water, 30 minutes before your planned meal. Pros and cons. Sustainable fat loss achieved. That is definitely a pro, right? Improves blood sugar control. We want that, right? Because we know that high blood sugar creates inflammation, which then disrupts cells, and then we won't be able to try to fix everything. Everything else will go chaotic. Reduces heart disease risk. Again, increasing blood sugars will then increase inflammation, buildup of cholesterol, and then you have coronary artery disease, and you have high blood pressure. All those things just go chaotic in your body, and we need to get some regulation. Temporary side effects, as you hear, nausea, constipation. They are all modifiable things that we can help you with. And then nutrition and training essential. That's where the real work comes in as well, because you got the weight off, but you want to maintain it. So this entire process, all of this that Zach and I are about, is helping you and walking you through the behavior modification that you will be doing on your own without even realizing that you're changing the way you're living. And it's going to be slow, but positive.
All right. Now into the fun stuff.
That was fun.
It was fun.
I was having fun.
No, thank you. Yes, you are very well versed within the physiology side. I'll give you that. But this is where I come in. Within Nova, we like to do a lot of weight training programs for people to, assist them with their GLP-1 weight loss, journey. So, just asking you guys, I don't know, crazy idea. Where do you think a GLP-1 weight loss journey could go wrong? And it's right here, when people do not weight train. And that is the most important thing you should be doing when you are on a GLP-1, is that if you're not weight training, you're not sustaining that lean tissue mass, which means your bones are going to become fragile. Your muscle is going to atrophy. You're going to become smaller, things like that. So with that, how do we put together a program for you while on GLP-1s? It's fairly simple. But as you can see up here, up to 40% of weight loss on GLP-1s is lean tissue without the proper resistance training, which is, that scares me. I don't know about you, but what we like to do is we just start out with a training frequency. 2 to 3 sessions per week, 2 at the minimum per week is what you want. But optimal would be 3 to 4 per week. So you're making sure you're hitting every body part and things like that. But focusing on full body and upper and lower splits as well. One of the most important, if you get anything out of this lecture, it should be this. One of the most important things you need to do while on a GLP-1 is get your protein. Because protein, as everybody knows, it supplements your muscle and things like that, your lean tissue. But as you're losing that weight, the protein will provide the support to keep that lean tissue, So 1.6 to 2.2 grams per pound or per kilogram of body weight daily. So for a 200-pound person, that would be about 145 to 200 pounds of protein. And it's better to distribute that across every meal, about 3 to 4 or 5 meals per day, even if they're very small meals, because, as we mentioned before, your appetite is suppressed. So it's hard to get those big meals in. So it might be a little easier for you if you were to get those smaller meals in little by little throughout the day.
Yes. Yeah.
Well,
yeah. That pounds. Yeah.
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 Oh, yeah.
Yeah.
Grams.
Yeah.
Sorry. Yeah.
Yeah.
Sorry about that.
Mm-hmm. Yep.
Yes. So.
That would.
If you're 200 pounds, then 200 grams of protein. So
Absolutely,
it goes hand in hand. A lot of people you might hear say 1 gram of protein per pound of body weight. So let's say you're 150 pounds, then 150 grams of protein is your sweet spot right there. It is, but it'll help you out.
But it's easier said than done.
Yeah.
Or easier done than said, I should say.
I mentioned the nutrition class, and they said the minimum is 30 grams of protein, and then the protein has to work. I don't know if you have that information as well, because even 30 grams sometimes is hard to get.
Yeah.
Yep.
Yeah,
So,
you can get it from a lot of different sources. So
yes,
we'll
and we have a slide dedicated to nutrition and things like that. But what I will say is when you're sitting down eating a meal, what you want to do is make sure some tips is to make sure you get at least 30 grams of protein within that meal. And that's pretty easy if you think about it this way. 200 grams of of chicken breast, which is probably the size of my fist, a little smaller, has about 25 grams of protein, and that's probably the leanest of protein you can get out of a lot of other things. But and when you kind of simplify it that way, it's a lot easier to think about too.
Mm-hmm.
But it's also a good thing to eat your protein first within your meal to make sure that you're actually getting it in before you start to get satiated, before your brain tells you, okay, I'm full.
Mm-hmm.
And it's just little things like that kind of tell you that like protein is important, so you have to get it in, and that's how you made sure you got it in with your meal. Protein supplements as well, such as your whey protein, your protein bars, things like that. Those are easy ways to just get some extra protein in throughout the day. I know I do that all the time. Before bed, I'll drink like a protein shake or something just to get a little bit in, to make sure I'm not good.
It's also like excellent.
Yes, yeah, exactly.
Mm-hmm. Yeah. And then on the other,
Excellent versus whey.
soy-based versus not.
Oh, isolate is soy.
I believe there's some isolate that is not soy. So whey is soy. Yeah. So, but so and he's talking about supplements, and somebody mentioned it as well. But also like like kidney beans, black beans, like they're simple sources of protein. We look at them as maybe carbs or vegetables, but there are protein in vegetables. Right, yeah. So chickpeas, tofu. So there's a lot of different choices that you don't have to pick up a protein bar. You don't have to have a protein drink. Hey, it looks cool and it's trendy now, right? But you don't need to do that. You can have, a bean chili. You can have chili in general, and you're getting a lot of it in that way. Yeah.
Yep. So next down here is exercise selection. So mainly you would want to focus on your compound movements, which would be your squats, deadlifts, bench press, things like that. Movements that require a lot of muscle activation.
Picking up the laundry.
Rows as well. So anything that requires, a lot of muscle activation, a lot of muscle movement, things that will expend the most energy, the most calories. That's kind of what you want to do, because you're utilizing a lot of muscles at one time and they're working synergistically. So you're going to become stronger in that sense and move the way your body's supposed to move. 6 to 12 reps is the sweet spot, but there was actually, I actually saw a recent study that people were doing 25 to 35 reps, but the main comparison there between 6 to 12 and 25 to 35 was that they both reached failure in a sense, which when you reach failure, that means you can't go anymore. But they realized that, okay, these people in these two groups were having the same results in terms of muscle hypertrophy and things like that, which means muscle building. At least 2 times per week, as I said, minimum of 2 sessions, and progressive overload is also very important, which means just increasing your weight over time. And here we go with the nutrition. So like I said before, and I will harp on this until the day that I die, high protein food is your most important, nutritional advice. It's the most important nutritional advice that I can give you throughout this entire lecture. And if there's one thing you leave with today, it should be that. Nutrition and weight training. Hydration is also very important. I like to say you should at least get 100, you should at least get half your body weight in ounces outside of your training. The reason why I say that is just because that's something I've learned. I was an ex-Division I football player, so that's something I've learned from my coaches, and everybody would tell us to do that. And being hydrated, drinking water is not only water but electrolytes too, is very key to allowing yourself to have good digestion and feeling good throughout the day as well.
And I'm going to jump on that. Also, because GLP-1s can naturally have you release fluid or go to the bathroom, hence why you have some constipation with that, because you're taking the water out of the intestinal system. You need to have that hydration to kind of balance that out. Also, if you're mentioning, electrolytes and such, because it can lower your blood sugar. You want to make sure that you're hydrated so that you're not getting dizzy from the dehydration and the lower blood sugars as well. So that is so important. So it's for kidney protection, it's for GI protection, and it's for brain and stability, because if you're dehydrated, you get a little stumbly, and we don't want you to fall.
Mm-hmm. So eating mindfully, when people hear that, they don't really know what it means, but that's why we're here. Mindfully eating is just keeping track, knowing that not sitting on your phone while you eat or keeping yourself distracted, but actually being in the presence of the fact that you're eating what you're eating and how fast you're eating it, things like that. So chew one thing at a time, eat one thing at a time. Don't cut your steak until. Go ahead.
I think back then people used to use food as a like a treat.
Mm-hmm.
Like, I deserve this because I worked a lot today. So
Mm-hmm.
stop doing that and stop using food as kind of like, I deserve this because I worked that hard.
As a reward.
Yeah, exactly.
Correct.
Yeah.
Yeah. As a reward. Right. Yeah.
Yeah.
Absolutely.
Not just eat because you want to.
Right.
Mm-hmm.
Your body's like, people stress eat. So maybe you're stress eating because you're not active enough. And then you release that stress from working out, and then you're like, eat more mindfully.
Mm-hmm.
Exactly. Yeah.
And what I have noticed, and thank you for bringing that up, is that some of our clients who are on the GLP-1s and following the training and nutrition aspect of the program, they are more thought-provoking in setting themselves up for the day as far as their meals. I mean, not total preparation, but at least like, I know that this is what I need to do. But also with their stress, because the GLP-1s hit that little sweet spot in your brain, you don't have that release of I need. It is because you're already feeling full. It's like you don't need that dopamine. You don't need that adrenaline to say, I need a candy bar. I'm going to go have like, a cafe latte with everything in it. It doesn't trigger that, so that they see that their stressful eating has reduced.
Mm-hmm. And one last thing on that last slide was just that your medication overall, like your medication is slowing your digestion down. So why not match that pace with your eating as well, right? So in terms of portion sizes, I mean, it kind of speaks for itself. Just monitor them, and that's why we're also here to help you along with that. If any of our clients who are struggling with that. But just like I said before, prioritize your protein, and once you get your protein in, that's when you can dig into the other stuff too, because your carbs and fats are obviously important. But making sure you get your protein in first is important.
Yeah, and not skipping your meals.
Yeah.
Even if even if you're a grazer, you just like to throughout the day, just eat a little bit here, eat a little bit there. You're not somebody who can sit down for an hour and really, take the time to enjoy, a bigger or larger meal. That's fine. Graze, smaller plates, smaller bowls, that helps. And it's okay if you wanted an ice cream. You know what I mean? Like, not that, you think of it as a reward, but like I said, throughout this whole process, people are changing their perspective on things. Not like, I can't have that anymore, because I think, and I know with my patients, the moment I tell them they can't have something, that is the moment they want it even more, and they will go for it. So I just say, you need to be thoughtful and, think about what you are eating. Sometimes writing it down before you actually put it in your mouth because if you're doing a food journal, then they're like, oh, wow, I already had this, and this today. So, again, it's the whole process. It's the mind, the body, and the pharmaceutical that helps as well.
Yeah. And one last thing, just thank you guys for attending. But, if you're ever on a GLP-1 or you are just here to learn about it, things like that, if you're spending money on a GLP-1 to kind of supplement your weight loss, and even if you have type 2 diabetes or something like that, why not, kind of change your lifestyle in that sense and use the GLP-1 to your advantage, right? Kind of use that to not as a crutch, as I mentioned before, but as a supplement to catalyze and allow yourself to get that weight off faster and change your entire body composition, right?
Inside and out.
Yes,
Inside
exactly.
out.
But thank you guys again for coming out. Really means a lot. Yes, of course. Yes, you
absolutely.
may.
Yeah, we're not done.
All the
but
questions.
Yeah,
All the
Yeah.
questions.
So I have heard that when you're on metformin, it can be harder to build muscle on metformin.
Mm-hmm.
It's the same thing true with GLP-1s.
Correct.
You're doing all this weight training and losing weight, but not really gaining any muscle mass. Does that happen with GLP-1s?
So that definitely can be a case because, like I said, like we were talking about, is that you're not eating as much, and when in order to gain muscle, you have to be in some sort of a caloric surplus as well.
Yes, right.
And
If you're trying to build muscle, this is probably not a good thing to do at the same time.
No, you can do it at the same time, and that's the thing. It's you have to do it together. So.
But I've heard though, even if you are,
No, you are correct. Yeah, in what you're hearing, yes.
He's a bodybuilder.
Mm-hmm.
He has said when you are on metformin and for
GLP-1s, all those type of medications, right?
It's very difficult to gain muscle mass.
Mm-hmm.
So if your goal is to gain muscle mass, this doesn't sound like this is such a good thing.
so yeah, go ahead. I'll let you go first.
You go.
Okay, yeah, and I had two things to say on that. So your doctor, you said he's a bodybuilder. Okay, so a lot of bodybuilders, I'm not saying your doctor does this either. A lot of bodybuilders, they like some of the people who go up on stages and stuff, a lot of them are on testosterone and steroids like that, right? Yeah. And as a natural weight training like lifter, you will not gain any muscle regardless if you're on a GLP-1 or not, unless you're in a caloric surplus, unless you're allowing your body to actually grow. Because if you're expending more calories than you're eating, you can't grow regardless. So when you're on GLP-1s and you're not eating as much, it's going to be hard to put muscle on. But if you're let's say you're a beginner in terms of your weightlifting, and you're a total beginner to this journey, and let's say you just have a fair, like a body composition of more on the fattier side than lean tissue, and you're starting to actually weight train, your muscle will actually grow because you're a beginner to that process, and your muscle has to adapt to that, to what you're putting it through 4 days a week of weight training. So when you're an experienced lifter, let's say you've been lifting for 10 plus years, you're not going to gain muscle, especially if you're losing weight and not putting in as much calories as you should be. Does that make sense? Right?
You're still getting strength.
Yeah, and you're
right.
exactly. Exactly. And there's a lot that goes into it too.
Yeah.
Like and she was mentioning strength, right? What goes into strength building is your central nervous system as well. That plays a huge role in terms of strength training. So there's a lot more that goes into it. And you're 100% correct as well. Like with metformin and GLP-1s, yes, it's hard to build the muscle, but what we're really trying to do here is not lose it. We're trying to maintain it so you can reshape your body composition in that aspect. Yeah, Mike.
I can speak to this a little bit as well. So it's about energy balance, and metformin is actually it's what it's activating on is something called AMPK, the activated kinase in your body, much like berberine, which they call it poor man's metformin. What the studies have shown is not that you can't build muscle when you're on metformin. What it has shown is that your muscle building may be reduced by somewhere between like 8 and 12%. So you're still going to build 90% of the muscle that you could otherwise build through strength training. But if you're a bodybuilder like your doctor, that 10% is a big deal.
Yeah.
If me or you or most of us in this room,
Right.
you're still building.
Yeah.
Exactly.
Yeah.
Elephant in the room. How about costs? Any insurance coverage, things like that?
Sure.
Yeah.
So, like I said, the name brands, when I mentioned that before, as you know, Tylenol and Advil are much more expensive than ibuprofen and your acetaminophen, and that's the same case here. Right now, I know they're thinking, you probably see it on the news and stuff, that they're thinking about lowering the prices of these as well, which is big news in terms of this, obviously. But as of right now, the prices of your name brand stuff would be around $800 to $1,200, maybe a little more, with no insurance involved. Sometimes insurance can cut that in half. Sometimes you can get it down to, $500, something like that. But there's also compounding pharmacies, which we utilize, that allow you to get the the ibuprofen and acetaminophen versions, which are your semaglutide and tirzepatide, for just about $300 to $400. And flexible spending and insurance can play a role in that as well and get the reduced cost down too.
Mm-hmm.
But yeah, did you have anything else to add on
Yeah,
that?
no. And then, I mean, actually, as I've been on my journey, I mean, I started my journey in January. As I was telling Mike earlier, my cholesterol was going up, my blood pressure was going up. 55 going on 56. We had a big event coming up, so I needed to plan for that. I wanted to feel better, have a little bit more energy. So I started my own, program here at Wolf, with weight training. I did lose about 20 pounds just eating right and doing the weightlifting, which thanks to Wolf, they upgraded their equipment and it's so good. So yes, there's a plug. There's a plug. But yes, and with the help of Zach, helping me with my diet. And for the last 10 pounds, it was tough for me. I'm like, all right, Zach, we're doing this. So for the last 10 pounds, I did do the GLP-1. Now, in regards to muscle, yes, it was a little bit harder for me to build the muscle, but I realized I wasn't eating enough. I wasn't eating enough. And that includes good carbs, fiber, protein. I wasn't eating enough. Good fats. And I was worried about my cholesterol going up, and he's telling me to eat avocado. And I'm like, but they're so high in fat, and I'm worried about that. He's like, no, that's where it all plays in. It is all about increasing your calories, building muscle. I'm doing that. I feel absolutely phenomenal, as a nearly 56-year-old, and I'm standing here with my nearly 23-year-old that I'm like, this is great. I feel like I'm almost as young as him inside, but I'm not. But I do, yeah. But energy-wise, I got it. Like, I run around the hospital like crazy, and I do my farmer carries with my equipment. So you can get your exercise with simple things here at the gym. Don't let the equipment, intimidate you. The simple things just with the little, bells, the kettlebells, the balls, all the bands, and then incrementing, that to a level when you start to feel stronger, you increase that and adding in the GLP-1 to help reduce that. So less for you to carry, right? And the more energy you will have. Yeah. So with good nutrition.
I have two things. I saw on TV the GLP-1 was supposed to go down to $50 a month. It was something. It was if you Google Carolyn, the press secretary, she'll address that.
Yeah.
The second thing is the most recent research that I read, and it may have changed because it was this month, that you can taper off this, and the satiation in your brain will maintain over time.
Absolutely.
So you don't have to take it for the rest of your life.
No.
Right.
Yeah.
So and think about $50 a month, and then you taper off, and you're good for the rest of your life.
So yeah, so in
That's the
regards
goal
to
right
that,
there.
yeah, $50 a month, I believe from what I've read and what I've heard, it may only be for your Medicare, Medicaid patients. I'm not sure if, commercial insurances, private insurances are headed that route yet, but we, times like things change. Like I am speaking about it right now and it's probably already changed. So
Exactly.
yeah, so yeah, it's Medicare and Medicaid, that's their primary, but they drive the system, right? So everybody kind of, yeah. So eventually, right, exactly. And, with Nova, although right now we're not taking insurances, the flexible spending, the health spending accounts, all that help you here with your gym memberships, because I know that, you can get that reimbursed through your insurance company. This, again, is also reimbursable through your insurance company. And then to answer your second question, sorry if you don't want me, you want to hop in or you good?
Go ahead.
Okay.
Yeah.
So the answer to your second question, so yes, as you taper off, because remember, during this entire process, you are changing your life. You're changing your lifestyle, the way you, wake up in the morning and, you're not putting all that heavy cream in the coffee or so. Like if that's the case, right? But it's behavior modification. When you get into your just normal, everyday, redundant, mindless things, we change that. You change that. And that's why weaning off eventually is something you can do and be successful on. Mm-hmm. So, yes.
So what does that strategy look Obviously, like there's an inherent conflict there.
Yeah.
For you guys.
Yeah.
So, what is the goal?
So the goal is monitoring and walking you through that, right?
Yep.
So I'll let you take the rest of that.
Yeah. So we begin by obviously getting in touch with, let's say from step one, somebody gets in touch, they go through our website, they want to get on GLP-1s. We get all their information, medical history and background, things like that. They put in their email, phone numbers, and we get in touch with them as well. What we do is we like to set up consultations and we talk to them about their current lifestyle. What are you usually eating throughout the week? How does your current workout routine look like? They might be doing cardio 6 days a week and saying, I can't lose any weight, But so what we usually do is we'll start out by making them, okay, well, when are you having your first meal in the morning and what does that meal look like? Or when are you going to the gym? Like, are you working out fasted? Like things like that. We look down from a interpersonal, and even like that comes down to sleep and stress as well, which is a huge factor. But we begin by making a program that revolves around your life, because life always has something to throw at you. So I always say you just get it over with, out of the way in the morning, get your workout, even if it's a 30-minute walk. But yeah, like just creating a program for them, and then going throughout their nutritional advice as well throughout their journey here. Like just making sure we everything we harped on here is what we say to our clients. Make sure you get your protein in, make sure you're hydrating, things like that.
Yeah.
That's kind of what.
So let's say like 6 months in, your patient has achieved their optimal body composition. Right?
Yep.
They've maintained muscle, they've lost fat, they feel better. They're still on the GLP-1s. You titrated their dose up.
Yeah.
Do you titrate that dose back down? Do you cold turkey them? Do you leave them on forever?
Yes. Yeah. So what we'll do is, like when they hit that point where they're like, hey, I feel good. Like we've hit our goal within 3 months or 6 months. And I always tell people not to worry about the number on the scale, just about what you see in the mirror, because that's what we're doing, is reshaping our body composition here. But yes, you're right. What we'll do is we'll eventually titrate that dose back down and kind of wean them off of that as well. Just so, because like we were saying, like the goal here is to get you to where you want to be, change your lifestyle and your habits in that process, and then like you have it from there on. Like we want to help you with the journey, get you kickstarted, and then you can take it off running from there.
And I'm sorry to monopolize it. And this is maybe in the weeds, but I think it's important. So the compounding pharmacies that you use, how do they price? We'll talk about price. The lower or higher doses. Is there a difference in price? Are they sending you preloaded pens that you're injecting? Are you drawing yourself? So how does all that work?
Yeah, so they allow us to draw ourselves. So we send it right from the pharmacy to your doorstep, because we're telemedicine, and that's what the new telemedicine laws allow. But we send it right to your doorstep, and we provide an email of insightful videos of how to draw that. And trying to keep the process simple, because people are like, oh, I've never either stuck a needle in myself, or I'm afraid I'm going to mess it up when I draw the
drawing
injection.
it up and all that.
So and that's why we kind of, for some clients, I've actually been on a consultation call with them, and we've been on a consultation call with them as they're going through the process themselves, to just walk them through it.
So if they're on 5 milligrams versus 25 milligrams, their cost 1/5 of the other person, or even.
So cost makes a difference. Yes. So lower dosing, lower cost. Higher dosing, higher cost. Absolutely. Because you're getting more of the drug, right? That makes simple sense, right? So, and you're a finance guy, you got it, right? Yeah. So lower cost, like lower medicine, higher cost, more medicine. So yes. So as you go, and then as we titrate down, obviously you may not need as much. So therefore the cost is going to be reduced. And another thing I'm going to bring in is what maybe somebody else is thinking but not saying it. You're hearing a lot about microdosing. So it's not, there you go. See, it's a very hot topic now as well, because of some of these GLP-1s, or I should say people who are on GLP-1s can experience some of the nausea, and that's a turnoff. You're like, oh God, if I'm nauseous and I feel terrible, then why am I taking this, right? So our pharmacies allow that to be something we can integrate into a program. The Zepbounds, the Ozempics are pens, and the pens do not allow you to microdose yourself. That is one big dose, and you're getting it, and you're stuck with it for a week. Now, because we're using compounded pharmacies, comes in a vial. We teach you how to draw it up. If we do decide that microdosing is a program or a path that you should be taking, because again, we want you to be successful, right? If your goal is this, we want to try to get you to that goal, and we want you to feel well on that, or else you're not going to, continue it at all. So the microdosing, this does allow you to do microdosing. So 2 to 3 times a week is something we can teach and integrate into your program if that's the case. And again, if you've reached your goal and you want to do the microdosing thereafter, the weaning process can include that. So maybe every 3 weeks you're doing an injection just to see how you're doing, because people are so scared to now stop because I'm going to gain the weight, as you had mentioned before. So it's like, okay, let's wean you off. You're going to continue on your same nutrition and training program, and we will continue to walk the walk with you and see how your progress is.
Yep. Exactly.
Yes.
I'm looking at this and it says, for those who are not eligible for GLPs, who would not be eligible?
Good question. People who have thyroid cancers, any kind of medullary, brain cancers related to the thyroid, people who have, significant kidney disease, like if they're on dialysis, that's something that we would want to do something differently with that population. But it's more the medullary diabetes and people who have pancreatitis. Currently, obviously you do not, but if you have a history of pancreatitis, that is something that we would want to monitor very closely, in which we can do that with laboratory results and closer monitoring. Yes.
Picking up on Mike's initial question on timing, are you on this for years? Is there a concern after a certain number of years on this?
No. It's similar to, the metformins and such, that if this is what is maintaining you and from the inside out, meaning your labs look good, you're hydrating, your kidney functions fine, you're not having any pancreatitis, liver issues, gallbladder issues, anything like that, your cholesterol's good, your blood pressures are good, then you can continue. It can continue as long as your blood sugars, are maintaining normal levels. It can continue on.
I don't drink
alcohol.
Yeah. So with that, you said affects the liver or helps the liver?
It helps liver.
So
it helps liver. Yeah.
Performing optimally. Should you
not drink?
Yes.
Right. So we're always here saying alcohol is bad, but I know I indulge in alcohol and I like a drink every once in a while, right? So I'll let Zach pick that up with the nutrition. So go ahead.
So I mean, everyone knows alcohol. It's just you can do it if you would like, yes. But
let's say you do like a shot a week,
Okay.
Maybe waiting a couple days after, right, would be better.
The Heart Association has guidelines for that because alcohol is irritant to your liver.
Yeah.
So you have to really be careful. My husband's a liver transplant patient. He can't have alcohol.
Yeah.
So it doesn't affect, sorry, I'm going to take the pathophysiology.
Go ahead, go.
So it doesn't affect the liver enzymes, okay? So it does not. It can reduce fatty liver, which you hear with a lot of adipose tissue and a lot of mid or central obesity, in which we see with all of us, right? Pants get a little bit tighter. So when you gain that fat in your belly, the liver grows that as well. So, and then you get something called liver steatosis or hepatic steatosis, fatty liver disease, okay? That can be reversed. It can, as the adipose tissue dissipates and you start to eat a healthier diet. Alcohol is definitely an inflammatory, catalyst, right? So we always say, drink smarter,
Yeah.
right? Be smart. Be smart with what you're doing, So timing wise with GLP-1, it doesn't matter. But really, alcohol is an inflammatory response to the body. So of course, we're trying to reverse that. So we're saying try to avoid alcohol, right? Also, alcohol is dehydrating. Why do you have the hangover the next day? It's because you're dehydrated. You're running to the bathroom when you're going to, when you're drinking. So you have to stay hydrated. So the liver, the kidneys, constipation, lightheadedness, dizziness. So for that reason, you should limit or avoid alcohol. Third, you eat poorly when you drink alcohol. So you have bad choices. So fried foods, very, very saucy foods, all that kind of stuff can be very irritating to the stomach, and you can have a lot of like burping or belching, heartburn, with these type of medications.
So
And that
you said you tried it. I also remember that it reduces your desire to drink. Is that
absolutely. It does. And taste, your taste has changed a little bit. And I think it's because you don't have that that dopamine response, like, oh, this tastes good, because it does shut down part of the brain. That aspect, not shut down part of the brain as far as your cognition or anything like that, actually, yeah. But it reduces the stimulation of that hormone. So so you don't crave it as much, and it tastes a little different. So again, and lastly, because you have some slower gastric emptying or stomach, moving motility, that it will hit you harder, because also it's a natural diuretic, the GLP-1s, that you're gonna, if you have less fluid volume in your body, you drink alcohol, it's going to raise the concentration of that and decrease your normal body fluid. So therefore, you're going to be a little dehydrated faster. So sorry. Yeah, great. Okay.
Can be a good or bad thing.
Yeah, good or bad. But we won't talk about that. But anyway, we're all talking. Be careful. Yes, just be careful. Yes. But all good questions.
Great questions.
Yeah.
Anything else?
Are you taking?
I'm not, no.
So with some of the evidence coming out now around non-weight loss type, cardiovascular type things, helping to stave off potential like early onset dementia, like all these different things.
Yeah.
Why not?
I agree. That's a good question. That's a great question. So, what we talked about before was the increased insulin sensitivity. And, the question I'll ask you guys is, how does the brain function? How does the brain have the energy to function? And that's because of the glucose that your body is provided with the food you eat. With the increased insulin sensitivity, people are now saying that, okay, your brain is getting more glucose, so you're more cognitive, you're more energetic, you don't have a lot of brain fog anymore, which is where the Alzheimer's, everything like that comes into play. It delays that, or not even delays it, just reverses it completely, which is huge. But those studies are still going on, and it's not completely confirmed yet, but they're saying that's a good theory, thinking about, okay, this can actually be the case. But you're right. In my case, I feel like I don't need to lose weight. I'm trying to gain weight, and I'm trying to put on muscle. So that's my whole thing behind it. But a lot of people will say, like, or a lot of doctors will, when they prescribe, they say you can't have a BMI below 30 or 28 without.
And it's all about risk factors. So
yeah, exactly.
If Zach came to me, saying that, just what like Mike was saying, like, this is so good, I want to ward off the family history that is now in my DNA, high blood pressure, diabetes in my family. So, Mom, I want to prevent that from happening. This is the time to start when you're young, right? And you have that knowledge. So if you keep your body in that normal or homeostatic process, right, from this point forward, you learn that early, then you will never reach that BMI or have those comorbidities or those risks that will then lead to needing that. So doing it, just by nutrition. So, I mean, we are not only a GLP-1, program, we do manage patients without GLP-1s who don't want to do the GLP-1s and who do training and strength and nutrition, with Zach and I. So there's two different paths so that you can take.
Yeah.
People who benefit more so because they want to reduce their risk of cardiovascular disease, reduce their diabetic, reduce their dementia, risk or Alzheimer's risk, or reverse that. And it can, but if you're doing it with nutrition, hydration and exercise, that's where you should be doing it. You should start there.
There's some research now using GLP-1s for Alzheimer's. Jefferson's doing it in the family practice. They have a brand.
Yep.
Right.
It has promising results.
Yeah.
But it's you have to use it very cautiously, because especially in elderly populations, whom are the people that are usually diagnosed with the dementia and Alzheimer's, because they're at higher risk for dehydration. They're at higher risk for that appetite stimulation normally, because as the body ages, you lose those instincts naturally.
And there's also a blood test. It's more accurate than doing the scans and the MRIs for Alzheimer's. So I'll give you a true story. One of my neighbors, they were going to go on Aricept for Alzheimer's. It works 1 in 10 people.
Mm-hmm.
I said, before you do that, make sure you have amyloid plaques, because you're treating for something you wouldn't have had. Did the blood test, does not have amyloid plaques, will you take the medicine? I just refer that out because it's experience. You like to help people.
Mhm.
If you do a blood test, it is very accurate in diagnosing Alzheimer's.
There you go.
Blood test is the best biomarker.
There you go.
Yeah, right. It doesn't lie.
Mhm.
It doesn't lie. But yes, so we could,
And-
and we do that as well. So, we do test biomarkers, from the beginning, and then integrate them throughout.
And the last thing I'll say
Yes.
with the Alzheimer's and things like that is the best known way to prevent and, especially prevent it, or not necessarily reverse it, but delay it as well, is regular exercise.
Yeah, absolutely.
So including that into your lifestyle, no matter what age you are, is definitely, a plus or positive. Good.
I would also like to add magnesium.
Yes.
Yep.
It's very important.
Yeah.
I like glycinate.
Glycinate
Glycinate's
is
helpful,
one of the
yeah.
most popular, but
Yeah.
magnesium's definitely a nutrient that almost everybody is deficient in.
Hydrated.
Yes.
Hmm?
Because
Mhm.
if you're eating too often while you drink water, it's because you're mag deficient.
Yes.
Yeah, you could be,
Your
yeah.
all your electrolytes, yeah, basically.
If you go, and
Mhm.
I learned
There you
a
go.
lot from him.
Yep.
I tell everyone to take magnesium because you don't produce that in your body.
Right.
So the only way to have it is eat it or supplement it.
Right.
Exactly.
And there's so many foods that have it as well. But
But it has no
again,
sugar,
no, even vegetables.
Mm.
Yeah.
Green leafy vegetables have a lot of magnesium in them. Yes, like beef. Yeah, seaweed. Yeah, right.
Bananas.
So yeah, so there's lots of things that we can incorporate. Yeah, and and then try to augment as we're going through the process.
Exactly.
So I appreciate everybody for being
Yeah,
here, and all
thank
the
you so
questions. They were
much.
amazing questions. So thank
Yeah.
you. Thank you. Oh, I can turn this off now. Mike, I think your microphone died on me. Yeah. Yeah.
Good job.